on this in a little bit, but I wanted to cover a couple things. Tocotrienols has some very powerful properties that tocopherols does not have. Number one, it has neuroprotective factors. It helps protect the nervous system and the brain against oxidative damage. Number two, it has anti-cholesterol properties. In fact, tocopherol has even been shown to increase cholesterol, whereas tocotrienols actually can help lower cholesterol. It also has other benefits like cardiovascular benefits. It makes the arteries less stiff. It helps make your liver less fatty, improves the skin, and improves hair growth, prevents sterility, and it also protects against stroke. Now I want to show you something in this book, which is quite interesting. Back in the 30s, the Shoot brothers, which they had a huge clinic, they're medical doctors, and this is based on 30,000 patients, okay? And they were mainly studying vitamin E back then. And I want to just kind of go through the benefits that they mentioned from vitamin E. And I'm talking about the whole complex. 1936, improvements in angina. That's chest pain, okay? 1940, fibroids, endometriosis, atherosclerosis. 1945, hemorrhages in the skin, mucous membranes, and decreased requirement for insulin. Interesting. 1947, therapy for gangrene, because gangrene usually comes from necrosis or breakdown of the tissue from diabetes, because you're having this oxidative stress affecting the circulation. So because vitamin E is such a powerful antioxidant, it has the potential as a therapy for gangrene. 1948, lupus, shortness of breath. 1950, varicose vein benefits, severe burn benefits. But I want to read you something else because they were highly criticized by mainstream medicine back then. And I want to just read a little quote. It says, "It was nearly impossible now for anyone who valued his future in academia to espouse, that means support, vitamin E, prescribe it, or advise it. That would make a man a quack at once." This situation lasted for many years. No amount of documentation could budge medical men from this stance. Literature in the positive was ignored and left unread. Individual doctors often said, "If it was as good as you say, we would all be using it." Okay? So this is what they were up against. Of course, we're still up against that. But the benefits of taking the complete complex are immense. Anti-cancer properties, anti-cholesterol, very powerful antioxidant properties. Tocotrienols are 50 times stronger than tocopherols, especially when you're dealing with the oxidation of iron in the body. It creates immune improvements. It's anti-tumor, supports the cardiovascular system, antimicrobial, and the list goes on and on.